In today's society, it has become normal to see stories on the news or on social media about child abuse. However, almost every story reported is about physical or sexual abuse, but another very common form of abuse that is often overlooked is emotional abuse. Emotional abuse is any kind of behavior that is designed to psychologically subjugate, control, or harm the recipient. In this presentation, I will be discussing the long-term effects of childhood emotional abuse, how the effects can be treated, and how the effects can later influence the abused child's future parenting style. When it comes to childhood emotional abuse, it is difficult to see how the effects can follow the child into adulthood. People tend to think that physical abuse would cause more of a long-term effect. However, embarrassment, social pain, harassment, and name-calling can be relived over and over, whereas it is nearly impossible to recreate physical pain. Although both forms of abuse cause long-term effects, research is beginning to show that emotional abuse might be making more of a psychological effect than physical abuse. The research study done in the article Sticks and Stones May Break My Bones: The Effects of Emotional Abuse by Helen Gavin studied a group of 165 participants to determine long-term health and psychological effects of emotional abuse. The participants were given a health perceptions questionnaire that looked at the participants' current health, prior health, susceptibility/resistance, health outlook, health worry, sickness orientation, rejection of the sick role, and attitude towards going to the doctor. The researcher also used the Child Abuse and Trauma Scale to measure the severity of sexual abuse, negative home environment and neglect, and punishment of the participants' childhood and ranked each of them on the scale. The researchers added a fourth construct to measure emotional abuse. The results of this study found that there was a significant negative correlation between emotional abuse and satisfaction with life and susceptibility/resistance to ill health. The study also found that there is a negative correlation between susceptibility/resistance and current health. However, the results did find that there was a positive correlation between satisfaction with life and current health. After the questionnaire, the researchers conducted interviews with the participants to learn more about the types of abuse they experienced. During the interviews, the participants gave information that the researchers considered to be indicators of emotional abuse, but the participants did not see them as such. This indicates that emotional abuse can have a psychological effect on the adult's perception of abuse. Although there are long-term effects of emotional abuse, there is a solution. With childhood emotional abuse only recently beginning to be studied more over the last few years, there is not much information on treatment options for those struggling with the effects of emotional abuse. However, in the last year, researchers have found what could be a promising solution to help those struggling with childhood emotional abuse. In the article, Treating Adult Survivors of Childhood Emotional Abuse and Neglect, a New Framework, by Frances K. Grossman, Joseph Spinzola, Marla Zucker, and Elizabeth Hopper, have found that component-based therapy, or CBT for short, could be the answer. This is a new therapy that still needs to be researched further and validated, but seems promising in helping adults cope with their emotional abuse. Component-based therapy has 4 parts, being relationship, regulation, dissociative parts, and narrative. Step 1, relationship, focuses on the relationship between the therapist and client. It is important that the client trusts the therapist and that the therapist is not closed off or judgmental towards the client. It is important to remember that people that have experienced early trauma can have problematic attachment. The second step, regulation, focuses on improving the client's self-regulation. The third step is dissociative parts, which focuses on the therapists and clients realizing what triggers the client's dissociative parts and working on preventing it in the future. The fourth and final step is narrative, which focuses on the client sharing all of their story, even the parts that are difficult to share due to the severity of the emotional trauma. This treatment can take months to years to complete all 4 parts and begin to help the client to heal. It is a difficult type of therapy that requires the therapist to look deep into oneself in order to help the client and is not a therapy for all therapists. Component-based therapy is for adults that have experienced childhood emotional abuse, but may work for teens as well. Further research needs to be done to ensure that component-based therapy is valid, but gives those struggling with the effects of emotional abuse hope. When looking at the effects of childhood emotional abuse, it is important to research if the abuse has a later effect on the abused child's later parenting style. In the article, Intergenerational Continuity of Risky Parenting, a Person-Oriented Approach to Assessing Parenting Behaviors, Courtney McCaulfield, Hilary G. Harding, Ann Schaefer, Rachel Z. Han, and Melissa Bright researched to see if there was an effect of childhood emotional abuse on future parenting styles. The study was done with a group of 53 female caregivers and 21 male children ages 8 to 11. In the research, the caregiver and child participated in 4 5-minute interaction tasks that mimicked common daily activities. The topics used were homework, siblings, and chores. After completing the interaction tasks, the caregivers completed self-report questionnaires regarding their history of childhood maltreatment. The childhood trauma questionnaire was used to assess childhood emotional abuse, emotional neglect, physical abuse, physical neglect, and sexual abuse subscales. 3 clusters were used to categorize the caregivers, being positive parenting, at-risk parenting, and negative parenting. The results found that 68% of the caregivers were placed in the positive parenting group and had experienced the least forms of childhood abuse and neglect. Those who experienced the most forms of childhood abuse and neglect were placed in the negative parenting group, which was 38% of the caregivers. There were only 10 caregivers, or 19%, placed in the at-risk parenting group for showing lower levels of anger, hostility, and unavailability than those in the negative parenting group. This research shows that childhood emotional abuse can have a negative effect on the future parenting style depending on the amount of abuse. In conclusion, childhood emotional abuse can have negative long-term effects. Some of these effects may not be noticeable to the individual in the case of not recognizing emotional abuse, whereas others have attachment problems. Component-based therapy is a new attempt at helping those who suffer with the effects of childhood emotional abuse learn to cope. Abuse in the childhood can later affect one's parenting style. I hope that this presentation has shed light on the need for more research on the effects of emotional abuse because it is evident that there are some serious effects.